Day 25, girls talk. Ladies, come to the front, please. Let's talk about a common mix-up down there. Have you ever wondered if that itch is a yeast infection or something else? Well, let's break it down. So yeast infections happen when there's an overgrowth of yeast. It's caused by the Candida albicans species. While bacterial vaginosis is caused as a result of an overgrowth of normal bacterial microflora. One of the major symptoms in yeast infections is itchiness. Vaginal discharge can appear like cottage cheese, which doesn't sound as tasty as it looks. However, in bacterial vaginosis or BV, you have a very strong fish-like odor, like it's impossible to miss. And that odor might actually worsen with sexual activity. There might be vaginal discharge or no vaginal discharge. If there's vaginal discharge, you can have a thin, grayish discharge. How does yeast infections come about? Antibiotics. So if you're used to taking a lot of antibiotics, it can actually cause a dysfunction of the normal bacteria that are usually in the vagina, leading to yeast infections. Yeast by itself actually thrives in warm, moist environments. So if you're constantly wearing tight clothes, it might be a good time or a good idea to actually go commando. Hormonal changes such as pregnancy, menstruation, birth control can also lead to yeast overgrowth. In bacterial vaginosis, remember I said that it's basically an overgrowth of the normal bacteria that appears in the vagina. So some things that may predispose you to having this is regular douching, using soaps or scented perfumes inside your vagina, poor hygiene. It's important to note though that bacterial vaginosis is not an STI, but a new partner or maybe multiple sexual partners can change your vaginal pH. Because bacterial vaginosis is caused by an overgrowth of bacteria, antibiotics is usually the best way to treat it. While yeast infections, over-the-counter antifungal creams are best indicated and they should clear up within few days. Have you ever been confused between yeast infection and bacterial vaginosis? Drop a comment down below if you have learned something new and follow for more easy health tips. Bye girls and guys that were watching. I see you.